taking a look at City Hall, the exterior of the Redwood City Hall. And here we are inside. I'm Maggie Skura. Welcome back to Comcast Newsmakers. And our guest for the next few moments is coming to us from an organization known as the Health Trust. Frederick Ferrer is CEO of the Health Trust, an organization whose motto, as I recall it, is making a healthier Silicon Valley, which is a large task. Welcome, Frederick. Nice to see you again.
Thank you.
Tell us how you go about doing that.
Well, the Health Trust, which has been around for 15 years, serving Santa Clara and San Benito counties, is really trying to advance wellness for everyone in the Silicon Valley. And the challenge with that is really, a large one, as you say, but the real critical part of it is, how do we really make sure that we take care of all the vulnerable populations where health is really the challenge? Because Silicon Valley is a very healthy place. We're healthy, wealthy, and wise, but that doesn't really apply to everyone in the Valley. And so the Health Trust is really dedicated to making sure that we include everyone in the health and wellness of our community.
So how did you go about identifying the different areas of the population that you felt needed serving?
Our trustees were really interested in making sure that we were making a big difference and really saying there's got to be a better way than kind of doing everything. Let's really focus and target. So the three areas that the Health Trust has targeted in Silicon Valley are healthy aging, since aging is really critical issue that's really up and coming, and people don't really want to admit to it here in Silicon Valley, where we have a very youth focus and orientation. But our older population is really the fastest growing population in Silicon Valley, not one that most people know. So healthy aging is an area that we're really working on and really making sure that we can make this a livable community that you can age well in. Our second area is healthy communities, and that's really looking at health disparities. Again, talking about who are the folks in our neighborhoods, the residents, who are not included when we look at good health and wellness that most of us can enjoy. And so really looking at health disparities and the social determinants. It's really not just about your health care or your medical care, it's really about those things that determine health, where you live, the economics of your job, if you're employed, kind of the pollution that might be in the area that you live in compared to somewhere else. So really looking at the health disparities. And then finally, healthy living, which is really looking at how do we address the ever-growing, and pun intended, obesity challenge. Childhood obesity especially is one that has grown over the years, but it's really come to that critical point. And so what we're looking at is, what's a prevention strategy? How do we get out in front of this, not to be able to treat it after it's there, but to really get upstream and look at a prevention strategy. And in doing that, we're looking at, how do you change the built environment? Is your community walkable? Is good food available? Do you have access to a grocery store? Let's look at farmers markets and community gardens, backyard gardens, school gardens, really looking at how do we get food access into the community. We've just started a new program called Fresh Carts Silicon Valley, and that's going to take mobile produce vending, a program that was modeled after what they do in New York City.
I was going to say, it reminds me of growing up in New York City.
It's exactly the same thing, and we have a very strong vendor tradition in many communities. And so what would that look like here if we were vending directly into challenged neighborhoods, really where there's a lot of fast food. So it's not really so much a food desert as a food swamp. There's a lot of really bad food for you. It's really, how do we get access to good food?
Well, tremendous amount of thought and process going on there, and we invite people to look at your website, in which we'll give you that information. I know it's all spelled out there, but before we leave, I wanted you to be able to talk a little bit about your event coming up on April 26th.
So Dining Out for Life is a way to eat out and fight AIDS. We're one of the largest HIV providers in Santa Clara County, and so Dining Out for Life, which is really an international night, Thursday, April 26th. There's 43 restaurants throughout Silicon Valley who are going to donate a generous proceeds from that dinner. So we'd like to invite everyone out to dinner on April 26th. If you go to our website, there's all kinds of, the restaurants are all there with all the information you need, and we'd love for people to come out. HIV is a real critical issue. People think it's already done, it's cured, it's over. It's really not.
You're working. All right. Thank you so much for all of that information, and we'll leave you so you can take a look at their great website. Frederick Ferrer, the Health Trust. That's it now on Comcast Newsmakers. I'm Maggie Skura. We'll see you next time.